So, good morning, everyone, and thank you for joining us today. First off, this is my first public announcement with Dr. Fitzgerald, and to me, it's an honor to be here with somebody who represents the public trust, somebody that is affiliated with public health, but for the province, she symbolizes so much to us. And so, like I said, it's an honor to be here. Today's announcement is about equity in healthcare. Growing up in Newfoundland, Labrador, in the rural parts of the province in northern Labrador, I know all about inequity in to be able to access healthcare. And even today, it's a struggle for me. And so, some days are really difficult for people who are trying to access healthcare, and I recognize that. But this announcement is about trying to actually ensure there's equity when it comes to access to vaccinations. And when we look at our province with the real, it's so large, and there's so much space in between communities. And sometimes it's difficult to actually be able to get to a place where you can receive the appropriate health care. And I know that, growing up in northern Labrador. And even today, that inequity is still there. So when we look at our most vulnerable populations, our youngest and our eldest are at greatest risk. And so therefore, it's important to address those gaps and to make sure that everyone in the province has access to the care that they need, right? That's probably not what you expected me to say here today, but for me as Minister of Health, and having such lived experience, it's sometimes it really hits home for me. And we know that we have to improve health outcomes for all our residents. But that only can be achieved when we are able to ensure that every one of us, regardless of our location or individual circumstance, has the supports we need to live and age well within our lives, our life histories. We are rebuilding our healthcare. Right? We have a new budget coming in as a new government. We are rebuilding our healthcare system brick by brick to ensure that it works for all of us and that no one is left behind. Healthcare for all of us is one of the pillars that our party stands on, this government stands on. This is why it's my pleasure to be here with Dr. Fitzgerald today to announce that in Budget 2026, our government is investing in the expanded eligibility for the publicly funded RSV vaccine. And this is about ensuring our most vulnerable populations will be protected. This expansion will ensure that all of those who are at high risk of experiencing serious health complications from RSV will now be able to get the vaccine free of charge. It's about equity and accessibility. This means that starting this spring, all infants aged 6 months and younger will be able to get the publicly funded vaccine, and adults aged 75 years and older will be able to avail of the publicly funded vaccine. Details on the rollout will be communicating in the upcoming months, but it's important for us now to do the announcement. I know there's been people who's been anxious, especially parents and of infants and our most elderly populations. Right? This is in addition to the high-risk groups that were previously eligible under the publicly funded vaccine, which includes infants at a higher risk of severe RSV infection, children entering their first or second RSV season who are at high risk of severe infection, and adults aged 60 and older in congregate living facilities. For many of us, RSV can look like nothing other than a mild cold, right? The common cold. However, those at high risk, such as infants, seniors, and individuals who are immune compromised, it can cause serious, even life-threatening complications. Dr. Fitzgerald joins us today, and we'll talk more about the RSV, but I want to emphasize to all of you that RSV vaccine is safe and effective. That's very, very important for us to know, right? The vaccine will provide enhanced protection for all of those who are at the highest risk of severe RSV disease, making our communities healthier and stronger. And also it gives comfort to people who may now be curtailing their activities, right? It's because they're afraid that they may catch it. Loved ones of people who have young infants at home or seniors, right? So this actually is a huge, tremendous thing in freeing up the anxiety that a lot of people are struggling with today. This will benefit all residents by reducing pressure on our emergency departments, ICUs, healthcare workers, and our overall healthcare system. So this is investment for everybody. Over the past few years, we've seen growing cases of RSV-related illness and hospitalizations in our province and across the country. Expanding the RSV vaccine program will now ensure that those who are at highest risk of severe RSV disease, including all infants under 6 months and seniors above the age of 75 in our province, will have optimal protection against serious complications. This means that once the program is in place, all babies born in the province will receive their vaccinations at the hospital before they head home. I hope this brings a great sense of relief to the parents that have been asking for this. And I seriously hope that all those who advocated know that we are listening. Listening to people in our province is an important part of how we will address the challenges of our healthcare system. And I recognize that so many people have a voice in our province, and we need to listen to those voices. Growing up in Northern Labrador, like I said, I witnessed inequity. I witnessed barriers to access to healthcare that really impacted and harmed people. And I know that other regions of the province, people growing up have experienced the same things. So for us, healthcare has to be for everyone. You have to be able to access healthcare, and it has to be equitable, meaning that you need to get the supports that you need when you need it. And that's so important. RSV disease disproportionately impacts people living in northern and remote regions of the province, where we often see high rates of hospitalizations than other regions. Also, transportation. If somebody is ailing, like an infant needs to actually have care, like sometimes they have to travel long distances. So in actual fact, these vaccinations will actually cut down on the need for people to have to travel due to complications. As Minister of Health and Community Services, this is my focus. I'm working to ensure that people are at the heart of every decision we make. And it can't be just words. It can't just be words. We have to ensure action. And we also rely on people like Dr. Fitzgerald to provide the sound advice to make sure that we are meeting the needs, the medical needs of our people in our province. This expansion is an important step in the direction of addressing the inequities that exist in our healthcare system. Today, I'm happy to kick off National Immunization Awareness Week with this announcement that it highlights our commitment is to making healthcare more accessible to all our residents. And before I hand it over to Dr. Fitzgerald, I would just want to take a moment to thank public health and all our healthcare workers out there who provide the immunizations throughout our province and are basically the face of this immunization. They provide a lot of comfort, reassurance, and really does help make the rollout go much smoother, right? And Dr. Fitzgerald has a lot of knowledge about the need for people to have trust. And that is what's built when we actually invest in our healthcare workers. They provide the trust that we need to be able to make sure that these programs that we roll out are successful. Thank you.
Thank you, Minister Evans. So I'm very happy to be here today at the beginning of National Immunization Awareness Week. I'd like to just take a moment as well to thank our immunization workforce across the health system, from public health to acute care to long-term care, primary care, and pharmacies. Our programs are successful because of your support. I'd also like to thank the people of Newfoundland and Labrador for their overwhelming support of our province's immunization programs, support that has allowed us to consistently lead the country in immunization rates in children. RSV is a common respiratory illness, so common in fact that by the time children are 2 years old, they will have been infected with RSV. And for most of those children, they will recover from what seems to be a cold. For others, though, it could mean a trip to the emergency department, a hospital or ICU admission, or long-term lung problems, especially if they become infected before 6 months of age. Starting this spring, we are going to change that story. Universal access to RSV immunization for babies born in our province will reduce the rate of severe RSV disease and help protect those at highest risk for severe disease. The vaccine will be administered in the immediate postpartum period before the baby leaves the hospital or very shortly thereafter, and parents who have always vigorously supported vaccination for their children in Newfoundland and Labrador will now have a safe and effective and widely available immunization for babies against RSV infection. So this is truly a wonderful news for our province. RSV vaccine is the latest in an expanding arsenal of protection for older adults against illnesses that can impact health and quality of life. Prioritizing vaccine for adults 75 and older allows us to focus on those at highest risk for severe RSV disease. We are finalizing details and logistics of this vaccine program and expect it will be ready to roll out in the fall. I'd like to take this opportunity to encourage older adults to ensure that their vaccinations are up to date. We often think about children when we think about vaccinations, but adults need them as well. Check with your primary care provider or your local public health clinic to see if you need to add or update any vaccines, and these can be provided by family physicians, pharmacists, and public health. Immunization is truly a marvel of modern science. Once deadly diseases are nearly unheard of today because of vaccines. Immunization is a privilege that we freely enjoy in this province. Immunization is safe and effective. Immunization prevents disability and saves lives. I encourage everyone to make the choice to get immunized. Thank you very much.